Good day, ma'am. I'm Marian S. Lumutak, and today I'm going to perform a return demonstration about general procedure for administering parenteral medications. So first is I'm going to wash my hands or disinfect to prevent contamination. Then second is I'm going to access the patient's medication record, and I'm going to check for the name, the dosage, the route, and the timing of the medication to be given to the patient. That is to ensure that we are giving the right medication, the right route, the right timing, the right dosage to the right patient. And the next is I'm going to check or access the ordered medication. So after reading the medications or the patient's medication record, I'm now going to check the label of the ordered medication, and then I'm going to compare it to the medication record. Okay, and then I'm going to lift it up and calculate the dosage. So after calculating the dosage, it is to ensure that we are giving the right dosage to the patient. And then after that is we're now going to prepare the vial and get the medication out from it. So I'm going to get the syringe and um, but first I'm going to clean the vial using a cotton ball. I'm going to in a circular motion to prevent contamination. Okay, and then I'm going to discard this. So now next is I'm going to prepare the syringe. So before that, we're going to check again the label for the accuracy. And then now we're going to get 2 ml of the medication. Okay. Then after that is we're now going to remove and then get the medication from the vial. Inject the air and aspirate the medication. Ensure that we are getting the right dosage in the syringe. And then ensure or make sure that there are no air bubbles inside. And then before withdrawing it, we're going to check the label for the accuracy. Okay. And then perform a one-hand scoop to prevent induration. And then, okay. Then the medication is ready. And we will now carry the medication or the syringe inside the tray together with the medication card and the cotton swab or the um, cotton balls for the preparation or for the administration of the medication. Then, so now assuming that we are now inside the patient's room and here is the patient. So what I will do is I'm going to identify the patient by letting her state her name and date of birth. And then I'm going to introduce myself and explain what I will do. Okay. So good afternoon. I'm Marian S. Lumutak and I will be your nurse for today. So can you tell your name for me please and your date of birth? Okay, great. Thank you. And then today I will be administering you a medication intramuscularly. So is it okay with you? Okay, great. Thank you. Then after that is I'm going to provide privacy to the client to promote comfort. And then next is I'm going to choose site for injection, making sure that I will not inject the site where it was injected previously. So for today, I'm going to choose or to administer the medication at the right deltoid. Okay, then now I'm going to expose the area. So Mrs. Cruz, can you expose this part for me, please? And it is for the easy access. Okay, great. Thank you. Let me do it for you. Okay. Making sure that I am not or that I am having a good lighting or an adequate lighting. Then after that is I'm going to don on gloves. So assuming that I am already wearing a gloves. And then after that is I'm going to position the patient, help her position in an appropriate position. Okay? Then after that is I'm going to clean the site using a cotton ball with an antiseptic solution. In a circular motion, I'm going to clean the area and then discard. And then let the skin dry. Because if we do not let the skin dry, then it will irritate the skin because the alcohol will go through the skin by the needle, which will be irritating to the skin or for the patient. And then next is I'm going to, when the skin is completely dry, then we're now going to administer the medication. So, but first we're going to place a cotton ball to or between the third and fourth finger. Okay. Then next is I'm going to get the syringe and uncover or remove the cap, making sure that the inside part is the only part that's touched by the needle to prevent contamination. Okay, then next is I'm going to locate the site and administer the medication. So assuming that I have already administered the medication, so I'm going to put it there and let it for a few seconds. And then after that, I'm going to discard the cotton ball and recap using the scoop method, and then we're going to dispose it to the sharp container. It is to prevent injuration. And then next is I'm going to wash my hands. I'm going to disinfect my hands to prevent contamination, and then leave the patient in a comfortable position. Okay. Then next is I'm going to document the procedure done for baseline data. And then after that, I'm going to observe for any adverse reactions or any untoward outcomes. And I will notify the physicians if there are any. And that would be all for this procedure.